Hello, everybody. Welcome to the Testicular Cancer Awareness Foundation Facebook Live. We're back with another installment of the Testicular Cancer Awareness Month Ask the Doctor segment. I'm BJ Lang. I'm a board member for TCAF, a two-time TC survivor, and I'm so excited that you're here to join us. If you're watching this live, you're welcome to put questions in the chat. And even if you're watching this later, after we go live, you could still put questions in the chat and we will try to answer those for you. We are very connected here at TCAF. More importantly, we want to make sure that you know about our upcoming event, which is going to be on the 20th and 21st. That's next week, our virtual testicular cancer conference. So that's really what we're going to be promoting here today. If you know a survivor, by all means, tag them here, share this video with them, invite them to watch this if you're watching us live right now, and even afterwards, tell them, hey, you should check out these segments. This really handsome guy is hosting it, and he's a TC survivor as well, so you should come over and check it out. As I said, it's April, so it is Testicular Cancer Awareness Month. So we've got some Ask the Doctor segments. Hopefully you've watched the last few that we've done over the past few days. And again, our conference is coming up here, and I'm going to talk a little bit about that. More importantly, we have the official Testicular Cancer Awareness Foundation podcast hosted by Stephen Crocker. He's a TC survivor and a board member as well for TCAF. It's called It Takes Balls with Stephen Crocker. So check that out as well. I'll probably share some more info at the end of this video as well for that. The 20th and the 21st, that's April. That's next week from 8 to 9 Eastern, 5 to 6 Pacific. We will have our virtual testicular cancer conference. If you haven't been to one of our in-person events, you could totally come to that. Let's see, what else is important? We're going to be talking about great things at our upcoming conference. So what kind of things might we be talking about at the virtual testicular cancer conference? How about why did I get testicular cancer? How did I get it? COVID, the vaccine and how it relates to testis cancer, the long-term side effects and prevention for testis cancer. We'll have breakout rooms with the doctors. You'll be able to connect with Stephen Crocker of It Takes Balls, the host of the TCAF podcast, and you'll be able to hear updates from our friends from the Uniball movie. So that's even more awesome. Q&A with our testicular cancer medical experts. We'll have doctors from Penn Presbyterian Hospital, as well as Penn Medicine, Indiana University School of Medicine, that work closely with Dr. Einhorn, by the way, the University of Colorado Health and Children's Hospital Colorado, as well as UC San Diego. So providers from all around who are going to be with us at the conference. And I hope that you'll be there with us as well. You'll be able to meet fellow survivors and caregivers from across the United States, as well as other countries. A great opportunity to make some awesome social connections. And as I said, if you've been unable to visit with us at our live events, which are going to be coming back, so please do follow the TCAF social media. We'll have a lot more in-person events coming up here pretty soon. Well, it's time to get to our Ask the Doctor segment. If you have a question, you can pop it in the chat, and let me get with this right now. Today's guest will be at the upcoming TCAF Virtual Testicular Cancer Conference, which again is the 20th and 21st of April next week. He'll be available during the Ask the Doctor segments there as well to answer any questions that you might have about testicular cancer. Things like treatment, side effects, long-term care, and more. These will be very small, intimate sessions. So this is a great opportunity for you to just kind of get really close with these medical experts, as well as meet other survivors and maybe ask some questions that you didn't get to ask your providers as you've been through your journey. Right now, if you have questions, again, put those in the chat. Feel free to tag and share and like as well. And we'll take a few minutes to answer these here on Facebook Live. Our guest today is an assistant professor at the University of Colorado Anschutz Medical Campus and Children's Hospital, Colorado. Dr. Kost's interest in testicular cancer has guided his training and career development. Testicular cancer is a disease that affects boys and men of all ages. For that reason, after completing his residency in urology and urological surgery, he pursued a fellowship in training in both urologic oncology and pediatric urology. This allows him to provide care to children, adolescents, and adults with testis cancer at both adult and pediatric hospitals. Please welcome Dr. Nicholas Kost. Hey, Dr. Kost.
Hey, how are you? Thanks for having me, BJ, and it's always good to be back with the crew from TCAF. So thanks for having me.
You bet. Now, I know that you might at any point right now get called out because you may have to go to the operating room. So we're going to try and get through some questions here as quick as we can.
Thank you. Yeah, sorry, it's been a little bit of a hectic afternoon.
Hey, I mean, you're a busy guy. You're a busy guy. So first of all, let's learn about Dr. Cost. Who is Nicholas Cost? How did you know that you wanted to go into urology? Did you even know that you wanted to be a physician? How did this whole thing start?
Yeah, from an early age, I kind of thought I wanted to be a doctor. I think the seed was planted. I had a younger sister who had a lot of health problems, and we spent a lot of time at the hospital when she was young. And she unfortunately passed away when I was a kid. And I think that really kicked it off. I looked up to a lot of the physicians that helped in her care, and that, just seemed what I wanted to do. I can't think of a time that's not what I wanted to do. And so kept with that all the way through training. And then as a urology resident, I kind of went into that because I like to operate. I also like to, see patients in clinics. So I didn't want to just be doing, trauma surgery where you don't have any outpatient experience with patients. So urology seemed to provide a good balance of those things. And then when I was a mid-level resident, I kind of liked everything I did, but I had a special interest both in peds and then on oncology. And so I thought about combining those two. And then I actually was diagnosed and treated for melanoma when I was a resident, and really kind of firsthand experienced this entity of adolescent young adult cancer. And it gave me pause to think about how I could pay it back or pay it forward. I guess it depends on how you think about it. And I realized I was in the field where the most common, adolescent young adult cancer is, with testis cancer. So it seemed like a natural fit. And so I thought, how can I get involved in this and really help take care of patients at this critical time in their life? And so I ended up pursuing training in both peds to kind of cover that end, and then the oncology end as well. And I've tried to carve out a niche in that area, taking care of primarily kidney and testicular cancer in that age group. And had the great fortune to get to know a lot of outstanding people, providers, advocates, researchers. So I really love what I do, and I try to make an impact. And I try to tell all the patients that I take care of that, for me, this isn't just a job. It's very personal. I would never say I can fully understand what someone else is going through, but at least feel like I can share my story a little bit so they can know that, I care in a way that's more than just, again, one other patient in somebody's clinic.
Yeah, absolutely. And you mentioned it right there, Dr. Cost, that you had the opportunity to, I think, experience something that a lot of your colleagues may not have had, that being really your cancer experience. So is there anything that really sticks out to you that you noticed when you were going through it? Did you see it very clinically and you were like, oh, I already know this is going to happen?
Yeah, I kind of went through all those phases, right? I mean, some of it not being a kind of cancer that I treat directly. So, I didn't know a ton about it. I tried to get on Dr. Google, obviously, and learn just like everybody does. So I can empathize with that when I see patients deal with trying to increase their own knowledge. But then I think there's a little bit of all of it, right? There are the times where you're just clinical and dispassionate about it, like it's happening to somebody else, and you're just like, okay, this is the next thing we need to do. And then there are the times where you're like, why is this happening to me? And then there's the thing that I feel like I can probably feel the most with my patients when we start talking about, okay, after the initial rush, you've had surgery, and then you're getting this mixed message about, oh, you've had this done, it was really serious, we rushed around to get all this stuff done at the beginning, but now, oh, you're going to be great, super high cure rate, like you don't need to worry about it. And that's really hard because you feel crappy because this just happened, and you're like, why did it happen? And they're like, you have cancer, and that scares you. But then days later, they're like, oh, but you're going to be just fine. But yeah, you need to keep coming back to all your visits. So
right. Yep.
It's this super mixed message. And so with the stage 1 testis patient, I feel such a kinship there, because that again, it's great to get good news that it's going to be fine, or they think it's going to be fine, but it really twists your mind around, and you then feel guilty that you even feel bad about it at all. And so I spend a lot of time, probably more than any other patient I see, with the stage 1 testis patients at the beginning, just saying, you need to let yourself feel bad about it. And you need to give yourself the space to realize this sucks. And I'm sorry it happened. And don't let anybody tell you just because it's going to be fine, that means it's not still a crappy thing to happen. Because I
Sure.
think that there's a real vicious cycle that can happen where guys, they're like, well, I'm upset with myself that I'm upset at all. And so, if you bury it down, it's going to come back up at some point. And so I think better to deal with it. And anyway,
Yeah.
that's probably the part where I feel like the most, I can offer the most unique experience from that standpoint, because I really felt that personally.
Yeah, absolutely. When we went there for the in-person testicular cancer conference over there to your facility, I remember that was the first time that I heard people actually talking from a provider standpoint about the whole approach, both mentally as well as physically. And I know that you were crucial in that as well, but I never realized that was such a big connection. And unfortunately, where I get my care right now, that isn't a primary topic, but it's such a big thing to be sure to cover that mental health piece as well. So I'm glad that you brought that up as well. And I encourage anyone who's interested in coming to the virtual conference to talk about that, because we're going to be having discussions around that as well. If you're just now joining us, it is, of course, Testicular Cancer Awareness Month. And we're here with the Ask the Doctor segment. We're here with Dr. Nick Cost. He's an assistant professor, surgery, urology, University of Colorado Hospital and Children's Hospital, Colorado. Are you good right now on time, Dr. Cost? We got a few questions coming in here.
I think so. I'm going to mute myself for just a second because I'm getting getting a call, but keep asking and talking and I'll be back.
You got it. You got it. See, look at that. We have providers right now that are right in the middle of everything. And Dr. Cost, of course, very connected with us here at TCAF. So I totally get how busy he is. And he'll be with us next week, the 20th and the 21st, for our upcoming virtual testicular cancer conference. You can go to testiscancer.org if you would like to register for the conference. And by the way, even if you're a survivor, if you're a current patient going through TC, if you're a caregiver, if you're a researcher, if you're a provider, all of you are welcome. We'd really love to have you come out. Please keep your questions coming here in the chat. And what I would like to do is do a quick screen share with you so that you guys could see what I'm talking about for the upcoming conference while Dr. Cost
all right.
Are you good? Are you good?
Good. Yeah, I got about 5 minutes. So
all right, good. We got 5 minutes. Good. We're gonna knock these questions out.
Sorry.
All good. A quick round of Yambo real quick.
There we go.
All right.
Yeah.
All right.
Speed round.
Here we go. Speed round. First question for you from Kim on Facebook. I have 4 sons. 3 of them had testicular cancer. 1 of them twice, 5 years apart. Is this environmental?
Yeah.
If not, what the heck's going on in my family? I'm sure a lot of people have asked that.
It may be a little bit of both. And Phil, Dr. Perazio gives a great talk on this. I've stolen that talk and given it myself a few times. We definitely think there's something genetic in this picture overall. It isn't involved in every patient that has testis cancer for sure, but there's a signal there, and how we interpret that, it's still unknown. The environmental piece is interesting because it appears that it may be more like the environmental exposure from one of the parents, and then that's passed along to their kids. So it may not be something that they were directly exposed to. So there's probably a little bit of both of those there, especially with such a strong signal in the family. But where it comes from exactly, it's not a smoking gun like tobacco exposure and lung cancer. We're still trying to unravel that though.
Absolutely. As you mentioned, Dr. Perazio is going to be talking about that, and he has done it for us in the past, has a very good discussion on that. So please do join us for the virtual conference, and you can hear all about that. Denise asked, Dr. Cost, is UC Health conducting any clinical trials?
Yeah, so in this space, we have a couple of clinical trials that are open. One is surrounding just looking at a novel serum tumor marker, microRNA 371, that we think will really surpass the traditional markers we use of AFP and HCG. And so there's a study ongoing, really, there's no intervention, it's just looking at that specifically. And then there's a trial looking for the younger patients under 25 that have metastatic disease, good risk metastatic disease, looking at either a regimen of chemotherapy that is traditional, such as bleomycin, etoposide, and cisplatin, versus a slight tweak on that, which would be bleomycin, etoposide, and carboplatin. Different risk profile, but thought to be long-term less risk for things like kidney function, hearing, and neuropathy. So that we have those ongoing. There's also a study looking at accelerated high-dose chemotherapy for the more advanced stage metastatic disease patients. So we do have those trials open and available, and we would really encourage patients, when they are eligible, to participate in clinical trials, because that's how we do better. And while we're fortunate that outcomes in general with testis cancer are good, they're not 100%, and we have to do better. And the only way we can do that is studying the disease.
Absolutely. Got to get that data. That being said, if you're a researcher out there, come to the conference. Please do tag your fellow research colleagues. Dr. Koss, Michael is asking, what age range when testicular when is it most likely to occur in men?
Yep. So really can occur from birth through late adulthood. We think of kind of two main classes of testis cancer. One is non-germ cell tumors, and those are more either before puberty or later in adulthood, but those are pretty rare. Most commonly are germ cell tumors. When people talk about testis cancer, they almost always really mean testis germ cell tumors. And those are most common between the ages of essentially 13 and about 45. And in that, probably most about 20 to 35. But again, we will see testicular germ cell tumors in kids under the age of 5, and we'll occasionally see guys in their 50s and 60s. But most commonly, kind of puberty through about 45 is really the most common.
Makes sense. Are there any certain foods that someone can avoid to help minimize the risk of TC?
Yeah, I think that's a great question, one we get a lot. Obviously, you think of what you take in must have a big impact on your body, because it does in a lot of areas, heart disease, diabetes, things like that. But in today, 2022, we don't have the data to say that there's anything you would eat that really would particularly impact you. In general, we think that, having a good, healthy diet, well-rounded, getting exercise probably does play some role in cancer, development in general. A lot of cancers are thought to be somewhat tied to metabolism. So it can't hurt to be healthy, and we would encourage that, but it's not as if I could say, oh, go, eat a diet that cuts out X, Y, or Z, or only eat these kinds of things, because we just don't have the data. I think probably the best thing you can do is living a healthy lifestyle and doing your self-exams. I think that more than anything would save lives from testis cancers if we could get everybody to be checking themselves frequently and knowing what to look for. And, you guys do a great job with all the social media push on self-exams, and, it needs to be not just April, right, but all the time.
Absolutely. Absolutely. That being said, before we get you out of here, Dr. Koss, can you walk us through real quick how to and what we should be looking for? When should we do a self-exam? While you talk about it,
Yeah, it's a great thing, and it's something, again, I realized I was telling patients all the time to do it, and then I didn't ever really talk to them much. So, there's really good, these graphics you have here. So we usually recommend kind of during the shower when things are nice and warm and the testicles have descended as much as they can. And we kind of have you do each testicle at one time. And we essentially have you run your fingers from the top to the bottom of the testicle, taking note of how the epididymis feels different than the testicle itself. Mm-hmm. And then putting that to the side, then really working your way up and down on the testicle and feeling for anything that feels out of the ordinary. And the little trick that I've taught people over time is I have them make a fist, and I have them feel that kind of soft, fleshy area between their thumb and where the bone for the kind of palm starts. And when you make a fist and you feel in between there, it should feel nice and soft, that kind of fleshy part. And that's similar to what the consistency of the testicle should feel like. And I tell them, if you're ever running your fingers through that on the testicle and you feel something like your knuckle, then you need to let somebody know. So I kind of contrast that soft, muscular part there. That should be what the testis feels like. If you feel something like the bone of your knuckle, then, let someone know.
Copy that. And would you say frequency at least once a month?
I think at least once a month, and I usually tell people once a week. Just can't hurt. I think most guys are checking themselves out in that area probably more frequently than once a month anyway. So while you're in the area, do your due diligence.
Awesome. Final question for you, Dr. Koss. What should what should a new patient, you have someone who's just now gotten the diagnosis, what are maybe your top 3 questions that you think they should ask their new provider?
Yeah. So, I would definitely inquire how familiar the team is with testis cancer. What kind of ties do they have to maybe a close regional center that sees it more if they don't see it much? And, what do they know about how to appropriately kind of get this workup going? Because I think there's some key things that could potentially be missed. Guys that don't get offered sperm banking before they start getting treatment, guys that don't get a discussion around a prosthesis. There's some of these things that are time sensitive. And I understand it's stressful when you're first diagnosed and there may be a big rush to the OR, for example, but it may be worthwhile to take a moment to pause and really make sure that you're dealing with a group that either has a high volume of experience or works with a team that has a high volume of experience, and that they're thinking about some of these survivorship issues from day one. Quality of life is really important in a disease where the cure rate's high. And, for example, fertility preservation is a key for guys at this age, especially if they don't have kids yet. And so, you may not think about that at that point. Maybe in your 20s and you're like, I'm not ready to have kids. It's not on my radar. But if you miss that opportunity, it certainly will be at some point. And so as a provider, it's really our responsibility to show you why that's important. And then I think, again, it's a disease where there's a tight correlation between volume and the quality of outcomes. And so trying to find a group that does this frequently and is familiar with it is really important.
Great stuff. Dr. Nick Cost, Assistant Professor of Surgery, Urology, University of Colorado Hospital and Children's Hospital, Colorado. Anything you want to say to folks to tell them to come to the conference next week?
For sure. Please come to the conference. I'll be there. I'll take more questions. I'm sorry I can't take more right now. Just have the duty calls. So but I look forward to seeing you all there next week. Thanks, BJ. And I'm really sorry to have to run.
Oh, it's all good. Thank you, Dr. Cost. Appreciate you.
Bye, guys.
There we go. Dr. Nick Cost right there again from the University of Colorado Hospital and Children's Hospital, Colorado, where he's also the co-director of the Surgical Oncology Program. So pretty awesome. So I mentioned earlier that I was going to do a screen share for you so that you guys could see what's going to be happening here next week. And I hope that you do consider come to our virtual conference. Look at this, everybody. Pretty neat stuff that we got going on. So there are many different reasons why you should come. You, a survivor, you, a caregiver, you, a researcher, you, a provider. 2 nights. We have 2 evenings that are going to be happening. An hour for the actual formal portion, and then each evening we will have an optional social hour where folks can just connect and chat and ask questions, very unofficially. Look at all of these wonderful people who are going to be there. And especially this guy right here. He is so handsome. He looks like John Travolta. My goodness, if that's not a reason to come to the conference. How about that, everybody? I think that is pretty much it from from today's Ask the Doctors segment. Really appreciate your time and for you to come visit us. Be sure to like, share, and tag if you know another survivor, if you know a caregiver, if you work in the urology field, if you're a researcher, and you're following oncology, share this out and let them see that, and be sure to come to the conference next week. I believe that is it from all of us. Yep. Thanks so much. We will see you guys later. On behalf of all of us here at Testicular Cancer Awareness Foundation, we will see you soon. Bye-bye, everybody. See ya.